That's
Yes.
correct. Can I examine your respiratory system today?
Yes.
Yes, so that will be listening to your sounds of your lungs and looking at your body for signs of respiratory disease. Do you have any pain?
No.
Okay, so I'm going to start just by looking. So I'm looking at the patient to see, has he got an oxygen mask? Is he in respiratory distress? Maybe is there a sputum pot around? And then I will start by looking at the hands. So if you can put your hands out for me. Okay, so in the hands I want to be looking to see if there's any clubbing, if there's any tobacco staining between the fingers. I want to see, if you turn your hands over, again, if there's any muscle wasting. And then I want to hold the hands out to check for carbon dioxide retention. You can put your arms out like this for me. I want to see if there's any flap for carbon dioxide retention. And obviously I would have looked for peripheral cyanosis as well. Rest your arms down. Then I will feel for the pulse rate. Whilst feeling for the pulse rate, I will watch the respiratory rate as well without telling the patient to check the number of respirations. So after measuring the blood pressure, I move up to the face. So I want to look at the eyes for any anemia. Okay, and in the mouth, central cyanosis. Lift the tongue up for me. Thank you. And rest it down. Obviously, I would do a full lymph node examination. I can do it from the front or from behind the patient, especially feeling in the left supraclavicular fossa. And I'll also look at the jugular venous pressure. If you turn your head to the side, and I want to just see if I can see the pressure in the jugular vein. Turn your head forwards. I will feel for the trachea to feel if it's central or not. This may be a little uncomfortable. And then I move down to the chest. Now I want to inspect the chest again. I'm looking for any deformity in the chest. Pectus carinatum, pectus excavatum. If there's a scoliosis or a kyphosis, I want to see if there's any scarring in the chest. I want to see if there's use of the muscles, the accessory muscles for breathing. Then, after inspecting, I want to palpate. So I want to measure expansion. So can you take a big breath in for me? In and out. And the hands should move apart approximately 5 centimeters. After that, I want to do percussion. So I'll start right at the top. Compare each side as I go. And don't forget under the arms and the axilla. Okay. After percussion, I will then listen. I want to ask the patient to breathe in and out, and I'm listening to the breath sounds or if there's any added sounds. So if you can breathe in and out for me. Through your mouth. Through your mouth. Can you say 99?
99. 99.
Thank you very much. Now we'll move on and do the same procedure but at the back. So at the back I want to measure expansion, breathe in and out. I want to do percussion. Then I want to do auscultation. So breathe in and out through your mouth every time I put the stethoscope on. And again, 99 for vocal resonance. Can you say 99?
99.
Yeah.
99. 99. 99. 99. 99.
So I will complete my examination for testing for sacral or peripheral edema. I want to ask for the temperature, the blood pressure, for a peak flow reading, for a chest x-ray, and to look at any sputum. And then I will find the patient. Thank you very much.